Okay, last but not least, we are going to have Dr. Professor Pauline Knox, who's going to present the policy responses to COVID-19 in the post-Soviet countries here.
Okay, thank you very much, Kai-Hong, and thank you for the opportunity to share my work. It's actually a joint paper between myself, Sultanat Janinova, and Hae-Sung Ha. So this is collectively a kind of early draft of some research that we're working on right now. So in terms of the aims of the research that we're looking at here, our aim is to examine the public policy responses to the COVID-19 emergency in 4 case study countries: Belarus, Kazakhstan, Russia, and Turkmenistan. And in a moment, I'll talk a little bit about how we extended this research into some data analysis into the 15 post-Soviet countries. But much of the detail of the paper is around 4 case studies in these 4 countries. These countries were selected because they're what's now known as neopatrimonial regimes. These are defined as countries which have clientelist political relationships, strong presidential powers. So that's well defined, if you like, in the political science literature. The way in which neopatrimonialism is captured quantitatively is through this varieties of democracy index. So on a scale of 0 to 1, 1 being the highest neopatrimonial measurement, Kazakhstan is 0.88, Belarus 0.76, Russia 0.85, and Turkmenistan 0.87. So there's some basis for comparability across these 4 countries in terms of how they dealt with the coronavirus crisis. It maybe seems appropriate in a health panel to give you a health warning. So the health warning here is that, researching the pandemic is like trying to hit a moving target. So this presentation is really a snapshot of using data from August 2020. And of course, there are always issues around reliability and quality of the data when you're looking at C19 data. So the results are therefore preliminary and very much work in progress. So at this stage, we came up with like a draft or a working hypothesis. And the hypothesis is that neopatrimonialism in these 4 countries is associated with better public health outcomes for their citizens because of the directive powers of government, compliance of the public, and the use of enforcement tools. So essentially, we're saying that governments responded here in a way consistent with neopatrimonial states. And this is the potential to reinforce neopatrimonialism in the 4 selected post-Soviet countries. So our methodology here was desk-based research in terms of the case studies itself, looking at content analysis of emergency legislation, social media reports, and official government reports. And then my colleague Hae-Sung Ha did an empirical analysis to explore the policy responses of the 15 post-Soviet countries to C19 compared with OECD countries. And I'll talk a little bit about that in a moment. So what does the existing literature tell us about policy responses during times of crisis? Well, in fact, extant research tends to focus on how democratic countries respond to unforeseen events. And there's very limited scholarship on how neopatrimonial regimes respond to crisis in general, which is defined as abnormal situations that create extreme challenges, and how they deal with pandemics in particular. So we haven't a lot to go on in terms of the research that's out there already. So what limited literature there is tells us a few things about how neopatrimonial states respond to crisis in general, rather than necessarily health crisis. So one of the ways in which they do that can be denial, in the hope that the crisis will fade away. denial even in the face of widespread concerns about a crisis, or they can acknowledge that a crisis is happening. They can perhaps procrastinate about their response to it. They can also use crises to consolidate their existing power bases. And some of the research tells us that there can be a misalignment between what the public needs during a crisis and the way in which government reacts to it. And the third aspect of the limited literature is that often during crises, there's peer learning amongst neo-patrimonial states. So they watch what each other is doing and try to engage in some kind of policy mimicry. Specifically in terms of dealing how neo-patrimonial states deal with health crises, there's an interesting comparison here between some of the work that has been done in other parts of the world and neo-patrimonial states. So academics like Christopher Hood from Oxford University did some research in terms of how the UK is responding to the health crisis and the United States. And he came up with this term called lightning rods. And it was meant to indicate that political leaders try to share responsibility. In other words, they are not willing to accept sole responsibility for these crises, and they deflect some of this through lightning rods. So in the case of Boris Johnson, you'll see him there in the short photograph alongside his senior health advisors, senior medical advisors. In the case of Donald Trump, Dr. Fauci and a few other medical experts were there to deflect attention, if you like, from individual leaders, although perhaps President Trump is not a particularly good example. But the distinction is made here between how leaders in neo-patrimonial states versus places like the UK, New Zealand, America deal with health crises. And that is the fact that because leaders are omnipotent in neo-patrimonial states, it's very difficult for them to avoid blame associated with crisis. So blame avoidance is more difficult where leaders are omnipotent, and blame can be apportioned directly to him or her. And this is important as we look at the 4 case studies. So the final strand of the literature I just want to look at is how do neo-patrimonial states maintain stability in times of crisis, because that is a particular worry for them. And the literature tells us that they try to legitimate their positions through social contracts with citizens. In other words, tell them, please weather the storm, everything will be all right after this blows over. They can use more coercive tactics like limitations on freedom of assembly, strict enforcement measures, or co-optation, which is to bind in key actors like the military and business into their regimes. So that, in very brief terms, summarizes what existing literature tells us about regime crisis. So what were the public policy responses in the 4 case study countries? So briefly, in Belarus, there was confusion and a contradictory response. Initially, there was denial on the part of the president. He told citizens to go and drive tractors, to drink vodka, and to go to saunas. There were no lockdown measures, and things remained open as normal, with factories, schools, public sector organizations continuing to work. There was a nationwide volunteer movement to support the medical staff, some modest financial assistance for vulnerable groups, and public dissatisfaction with how the C-19 crisis was handled merged then into the massive social unrest that we have seen since Lukashenko's presidential election. Moving to Russia, Russia adopted a kind of multifaceted approach to the crisis. They set up an anti-crisis fund to support the economy and citizens, support for unemployed people, tax breaks for small and medium-sized enterprises. At the same time, they had very strict messaging control through legislation. So there was repression of those who complained against lack of personal protection equipment and underreporting of statistics on C-19 deaths and cases. And they also amended the criminal code in law very quickly to fine people for what they called spreading false information about public safety, and fairly hefty fines and potential imprisonment. Kazakhstan also adopted a multi-level approach, if you will, called a state of emergency at 2 national lockdowns. It provided national assistance to its citizens, about 42,500 tenge per month, although there were lots of complaints that was very badly administered, despite the fact that Kazakhstan has been praised for e-government. There was initial confusion about the extent of the virus by not registering patients with undefined pneumonia as coronavirus cases. And the use of surveillance technologies, Sergei, extended to contact tracing. And the final case study, Turkmenistan. Turkmenistan, as you know, is a very closed country, and there was complete denial in Turkmenistan that there was any problem. So they denied to the outside world, yet there was covert preventative measures happening in country. A lot of the assistance came through self-help, excuse me, amongst citizens, from banning masks to wearing mandatory mask wearing. Excuse me. There was a large quarantine zone set up for over 1,000 patients, and during the World Health Organization visit to Turkmenistan, they said they claimed that there had been a dangerous dust from the Aral Sea, and this was causing this undefined pneumonia. And activists and journalists, some activists and journalists were arrested and prosecuted for actually using the word coronavirus and destabilizing public order. So the case study suggests that these 4 neopatrimonial states used a mix of social assistance and enforcement measures in response to COVID-19. But we wanted to widen the research out to look at other post-Soviet countries to see if there was an association between their policy responses and the public health outcomes compared to OECD countries. So my colleague Haesung Ha did a quantitative analysis that looked at excuse me, 2 key variables. And I know one of the other speakers talked about limitations associated with these variables. The total confirmed cases of C-19 per 1 million people, and the total deaths attributed to COVID-19 per 1 million people from 160 countries. The public policy variables that were used in this analysis were taken from the Oxford COVID-19 response tracker from the Blavadnik School of Government. These public policy measures look at government policies and interventions across a series of 18 indicators, including closure and containment, economic response, and healthcare systems. So you won't get the detail of this from this fairly congested slide, but just to summarize some of our initial findings from these descriptive statistics, there is a significant difference between the use of these stringency measures, school closures, workplace closures, cancelling public events. So a significant difference between stringency events, economic support measures, and public health measures between post-Soviet and OECD countries. In post-Soviet countries, there was a much wider use of stringency measures with greater enforcement powers, and a significantly lower number of deaths per million, although the number of cases per death was lower, but wasn't significant. And of course, this needs more data analysis to look at causal relationships. These are simply looking at significant differences between OECD and post-Soviet countries. So my time is pressing. So what were the kind of similarities and differences across these policy responses? In the case of Turkmenistan and Belarus, there was denial about responses to the pandemic. In the case of Turkmenistan, completely denied in its existence. In the case of Belarus, a gradual acceptance of the latter. For Russia and Kazakhstan, there was acknowledgement that the pandemic exists, although initial preparation and healthcare facilities were weak, as was the case in several developed countries. And the final point I want to make is just to go back to the literature. In terms of leadership during a crisis, blame avoidance through distributive leadership has actually proved difficult given the omnipotence of the leaders in neopatrimonial states. So I'm going to leave it there. I know the chair has asked for some policy considerations. So thank you very much.
Thank you, Colin. Yes. Before we move on to the next session, I just want to ask this question for all speakers, that the context is very peculiar for Central Asia based on your last presentation on governance. So despite all these regional peculiarities and the context, we still have to rely on evidence-based policy, taking into regards the peculiar geography and the climate of Central Asia and Kazakhstan. So we'll save that for the last session. So we'll leave now and move on to the last panel discussion.